training I've done, film clips here and there and workshops, but I feel like I've been slowly deteriorating for about 4 years of chronic pain. But this weekend I accessed some movement on my own, not through a FI, that just gives me that hope that, maybe I will continue walking another 10 years. So, okay.
When an adult has had a stroke, brain injury, when a veteran is injured, or when a person suffers from debilitating illness, oftentimes the Anat Baniel Method can provide breakthrough results. What is often overlooked is that after trauma, the brain is a changed brain that needs to manage a changed body. It can no longer manage the body and organize itself the same way it did before the trauma.
So I had 2 brain injuries in the space of 9 weeks, and neurological vision impairment. The brain hit the skull on both sides. So this work has been phenomenal in making huge changes in mobility, in cognition, in vision. This work moves so quickly that I got my down field of vision completely back within a month of doing it.
With the Anat Baniel Method, we use the 9 essentials to communicate with the brain to help it reorganize itself in new and effective ways, preventing the creation of limiting new habits that otherwise would form. I've been honored to work with thousands of adults who have suffered from chronic disorders or traumatic injuries, who could no longer see a future for themselves, and with the Anat Baniel Method have regained a full and exciting life, sometimes even better than before their injury.
So I'm Joyce Cameron, and I'm a 4-year breast cancer survivor. And I visit my surgeon for follow-ups regularly. And just a couple of days after a training, the conversation, what have you been doing, how are you? I said, what I was doing, and I said, that's how I got my range of motion back, and I just raised my arm. And the conversation continued, and she said, her face got really intense. She stopped mid-sentence and looked at me and said, do that again. I did it again with no difficulty.
I recommend that you read my book, Moving to Life, and take private sessions with one of our practitioners. We also recommend that you participate in one of our workshops, and if you're well enough, do one of our DVD programs at home.